Hi everybody. Today I'm just going to go over some of the bony landmarks of the lower extremity. These are very important locations on the bone where there's a lot of attachments for muscles, which is important for everything we do from walking or standing. It's called the pelvis, and it's made of three bones: the ilium, the ischium, and the pubis. And up here we have the iliac crest, iliac fossa. Right here we have the superior rami of the pelvis, pelvic tuberosity, the ASIS, that's the anterior superior iliac aspect, and the AIIS right there. And this is a muscle attachment for sartorius, and as well rectus femoris just below that on the AIIS, and that's one of the quadricep muscles right there on the front of the leg. So I'll spin this guy around, move here, and we have the three what we call gluteal lines. This is the attachments for the gluteus maximus, medius, and minimus, which is the posterior gluteal line, the anterior, and the inferior gluteal line right there. On the back we have the PSIS, just below it the PIIS, so that's posterior inferior iliac, and then the greater sciatic notch here and the lesser sciatic notch, just some grooves there in the back of the pelvis. And we have the ischial spine, it's this bony protrusion right here, and below that we have the ischial tuberosity, which is commonly referred to as the sit bone. That's that right there. Alright, so in here where this ball and socket joint is, which we call the hip, we have this this area, this concave area, and it's called the acetabulum. You ever wonder what these holes are called? Those are called the obturator foramen in the pelvis. Usually that's filled in with a membrane, but there's a little channel here where a canal, it's called, where different nerves pass through and arteries. So next we'll move on to the femur, biggest bone in the body. On the top, like I said before, it's a ball and socket joint. So right here, what's the ball part is the head of the femur, and below that's the neck. So right now we're looking at it posteriorly from the back. So on the posterior aspect, in between these two bumps here, which are called trochanters, this is called the intertrochanteric crest. And so this would be the upper trochanter, and that's the lower trochanter right there. So I'll spin them around again and look at them from the front. So on the back we had the intertrochanteric crest, which connected to two trochanters. Well, in the front we have the intertrochanteric line, it's called, which is right there. And yeah, one important thing I forgot back here was this, which is the pectineal line, where it's a insertion point for the pectineus muscle, which connects these two bones together. So along the front here are insertion points for a lot of important muscles, which we would call the quads. There's four quads, which is quadratus intermedius, the most internal one. You have rectus femoris, which is on top of that. That's our major quad muscle, which flexes the hip and it also extends the knee. And the rest of the quads just extend the knee. So that would be vastus medialis in the middle over here, and vastus lateralis over here. And they attach. They actually go all the way around back and connect to this thing right here, which is called the linea aspera. So one wraps around one way, connects to that, one wraps around the other way to this, I don't know if you can see really well, but it's a kind of a raised area right here. And that's where those muscles attach to. And then if we keep going distally to the bottom of the femur, we have the lateral condyle and the medial condyle. And above those we just call them epicondyles, lateral and medial epicondyles. and a groove right here. I believe it's called the intercondylar groove or something like that. I don't know. Okay, in the front we have the patella right here. And that's sesamoid bone, which is important for a lot of movements in joints. It acts as like a pulley between the upper and lower bones right here to allow for greater movement. And if we continue down, we have two bones here in the lower part of our leg. And those are called the tibia and fibula. So we'll start with the tibia. And in the front here, it's a tibial tuberosity. Tuberosity just meaning like a bump. And that's where muscles of the quad group attach to, right there in the front. Important for knee extension. And over here there's one called Gerdy's tubercle. Where is it on this? I think it's this right here, I believe. And that's also insertion point. And along the back we have the fibula that comes up here, and that's the fibular head, which biceps femoris attaches to, which is one of the hamstrings on the back. So those are important for flexing the knee on the back, if you think about it like that. And we have the shaft of the two bones that come down where, this is where on the front we have tibialis anterior, which is a muscle that brings your foot up towards you, like your toes towards your face. So that's on the front. And that's actually called dorsiflexion when your foot does that. Then on the back we have our calf muscles, which are called, there's actually a few of them. There's the gastrocs, which are the two big ones, like two big kind of tomatoes on the back of your leg. And then below that is soleus. And what those do is it plantar flexes the foot. So in the front we had ones that dorsiflex, which bring your foot up, and these ones on the back push your foot down. Like if you're walking upstairs, you're pushing off or going on your tippy toes. That's what those do. So those come down here to where the Achilles would be and attach down here on our heel bone, which is called the calcaneus. So I'll move down here and take a look at these feet. So the heel bone right here is the calcaneus, and above that where these two bones attach to in this what we know as the ankle, this is called the talus bone right here. It's one of the tarsals, and that attaches to one over here called the navicular in front. And right here, this ankle joint, where this, where the movement occurs, it's called the mortise in the ankle joint. And on either side of the ankle, which we call the ankle bone part, they're actually called malleoli or malleolus. This is the lateral malleolus and the medial one. So we were talking about the tarsals, which is a group of these bones in here. The navicular, and in front of that are three cuneiform bones. The medial, the medial, intermediate, and lateral cuneiforms. And then just lateral to that is the cuboid bone. So in front of that are the phalanges. Metatarsals. Tarsal, metatarsals. That forms the tarsal metatarsal joint. And in front of the tarsals are the phalanges. And the phalanges on the toe, there's two of them. And the rest of them, there are three.